Do you frequently feel like your heart is pounding, or you're having pain in your arms, legs, or chest after getting a shot or IV in the hospital? What if I told you that the medicine meant to help your blood flow might actually be causing a dangerous problem? That's what can happen with heparin-induced thrombocytopenia, or HIT. Imagine your body gets confused instead of healing. It starts forming clots because of a medicine it sees as a threat. HIT is a rare but serious condition where a common blood thinner called heparin causes your body to destroy its own platelets, tiny cells that help stop bleeding. It sounds crazy, right? A medicine causing clots instead of preventing them. But it happens, especially in people who have been in the hospital for surgery or serious illness. Let's break it down so you know what to watch for and how to stay safe. So what causes HIT? Think of heparin not as the villain, but as the accidental trigger. Heparin is a medicine used to stop blood clots, common after surgeries or during heart attacks. But in some people, the immune system gets confused. It sees heparin attached to a protein in your platelets, called PF4, as a dangerous invader, like it's a virus. So, your body makes antibodies to attack it. These antibodies then stick to the heparin-PF4 combo and cause platelets to clump together. Instead of protecting you, your immune system now overreacts and destroys your own platelets. And here's the scary part. When platelets drop and clump, your blood can form dangerous clots. It's like your fire alarm going off during a rainstorm and calling for more fire trucks instead of canceling them. This usually happens 5 to 10 days after starting heparin, especially in hospital settings. How do you know if you might have HIT? Let us play detective. Have you recently been in the hospital, gotten a shot under your skin, or had IV heparin, and now your arm feels swollen, red, and painful? That could be a deep vein clot. Or maybe you suddenly got short of breath or have chest pain. That might be a clot in your lung. Some people notice bruises easily or tiny red dots on their skin, like someone sprinkled pepper on you. That is from low platelets. Others may suffer strokes or heart attacks without knowing why. Here is a quick check. If your platelet count drops by more than 50% after starting heparin, especially between days 5 to 10, HIT might be the culprit. Remember, the danger is not just low platelets. It is the clots that can form even while your bleeding risk goes up. Confusing, right? Your blood is both clotting too much and bleeding too easily. Diagnosing HIT isn't done with just one test. It's like solving a puzzle. Doctors first ask, did you get heparin? When, how much? Then they check your platelet count over time. A sudden drop is a red flag. They might use the 4TS score, a checklist for thrombocytopenia, timing, thrombosis, and no other cause. Score high, they'll order special blood tests to find HIT antibodies. But here's the catch. Even if the test is positive, not all mean you have active HIT. Treatment, stop heparin immediately. Even baby doses and flushes can make it worse. Then use a different blood thinner that doesn't trigger HIT, like argatrobin or fondaparinux. These are given through IV or shot until the danger passes. Never use warfarin early. It could cause worse clots. And platelet transfusions, only if there's serious bleeding. The goal: stop new clots, prevent old ones from growing, and let your platelets recover safely. Can we stop HIT before it starts? Yes, by being smart. If you've had HIT before, never get heparin again, ever. It's like being allergic to peanuts. Even a tiny bit can trigger it. Doctors should mark your chart clearly, heparin allergy, do not use. In hospitals, they now use other blood thinners when possible, like enoxaparin, a cousin of heparin but lower risk, or direct oral anticoagulants, DOACs. For surgeries, they avoid heparin or switch quickly. Patients can help by telling every doctor, I had a bad reaction to heparin, even years later. Simple actions save lives. Think of it like sunscreen. If you burn easily, you protect yourself before the sun hits. Same idea. Prevention means awareness, communication, and safer alternatives. Science never stops. Recent advances in HIT are exciting. Researchers are now creating special tests that give faster, more accurate results, some in under an hour. Imagine getting a diagnosis during your clinic visit instead of waiting days. New drugs like bicegumab are being tested to block the harmful antibodies safely. Also, AI tools are helping doctors predict who is at high risk before giving heparin, using medical history and lab patterns. Another advance, safer lab tests that can tell the difference between harmless antibodies and dangerous ones. And patient registries across countries are helping doctors learn faster by sharing real cases. It is like a global team solving a mystery together. The future, possibly a simple blood test to screen everyone before heparin use, stopping HIT before